I think that there is a lot of apprehension in the African American or person of color community in regards to taking vaccinations and medical care in general. I think to some extent that really is dependent upon, or let me not say dependent, but it's a result of the history, that people in my community have had with the federal government, with healthcare in general, and that these entities have broken the trust of people that look like me. And with this broken trust comes lack of trust when we're in this pandemic and we're saying this vaccine is something that we need to have. This vaccine is something that will help to save lives.
Specifically with COVID, when you look at the numbers are phenomenal in people of color, POCs, getting infected and then becoming sick and dying from it. And there are a number of different reasons for that. Again, healthcare disparities, seeing a doctor, and then getting admitted. As a result, we need for our people in our communities to, one, be educated, but two, be able to get access to the vaccine. What we see, though, is a concern. Is this going to hurt us in some way? And what I tell my patients, generally speaking, is, again, there's good reason to ask for information and to be educated. But in this situation with COVID, the information is out there. We're very lucky in that we have 3 very good vaccines now from an efficacy standpoint and from a side effect standpoint.
I did get the vaccine. I got the vaccine the moment that it was rolled out and available for healthcare providers. And, honestly, my reasoning for getting the vaccine has been multifactorial, So I have professional reasons for getting this vaccine, but I also have personal reasons for getting this vaccine. I've lost a family member to COVID, quite transparently. My father passed away with COVID, and I would have loved for him to have the opportunity to be vaccinated. I would have loved to have been vaccinated myself when he was ill, because maybe I would have gotten a chance to see him. So, there was nothing that was gonna stop me from being vaccinated at that point. When people have a provider or have a physician that they trust, that they understand, not only understands the science, but understands the community, understands the world that we live in, then I think it leads to a more open discussion about, what could be the right decision or what could be the wrong decision, right? So, the African American community, the community of people of color, we suffer disproportionately from COVID. Everyone knows someone that has, passed away from COVID, right? But I think it's being able to discuss that with the patient, being able to put it into kind of real life perspective and to say, hey, we don't have to continue to be a statistic. We have this intervention that could potentially save lives, save the lives of the people that live in your home, save the lives of our elders. Why not, try it? Why not attempt it? But I think it all starts with having good interaction and trust between the physician, the provider, and the patient to be able to build upon that.
After doing research, I said I want to be at the front of the line, and I was at the front of the line to get my vaccine. I have to admit, I'm very scared of needles. But I have to say, when I got vaccinated, the first vaccination, I did not feel it. I didn't even know that they had stuck me with the needle. I think for me, what I've noticed is, again, I still wear my mask. I still try to minimize contact, 6 feet separation. When I go to restaurants, I try to eat outdoors now that restaurants are beginning to open again. But I have that sense that things are going to be better, things are going to be okay. So, my message for my community is do the research, but get vaccinated. This is what you can do to help your community, to help your family, to start being able to interact with loved ones, grandparents, and feel comfortable that you're not bringing something home for them.
Understand that at the end of the day, my recommendation, my support for this vaccine is really based not only in science, but personal experience and true and abiding conviction that that's the right thing to do right now.